Hey, everybody. Welcome to Keeping It 100, where we have these open and honest conversations to make sure you get all the information you need to make better health decisions. I am your host, Dr. Krista Motley. And of course, we have a good show in store for you today. And as always, if you think of questions, just pop them in the chat. My colleague and good friend, Dr. Tyan Thomas, is here behind the scenes helping to get those questions answered. So let's get started and bring in my amazing co-host, Mr. Dr. George Mink Jr.
Good afternoon. Good afternoon. Good afternoon, doctor.
How you doing?
How
How
you
you doing?
doing? I'm good. I'm good. Feeling good about what we're doing. We're making some positive strides, so pretty good. You my partner, so we got it going on.
We do. We got to get it going harder because the country has reached 1 million COVID deaths
Wow.
since the pandemic started, and that's a sobering number. It's just really unbelievable the number of people who have died in the US. And this is, the greatest country in the world, they say.
Hmm.
It's really sad. Really, really sad.
Yeah, definitely.
Um, I know that when you look and you compare the US to other countries, it's a lot of the deaths that could have been prevented early on. And it's just so sad to realize that our leaders didn't make the best decisions for us in the beginning of the pandemic. And it was new for everybody, but it
Hmm.
was certain things that we knew and we understood, and our leaders, they just, I don't know. It's really disheartening. It's really disappointing.
Yeah, they dropped the ball. But that's spilled milk. So
It is. It is indeed, indeed. Now, thank God for vaccines. Thank God they
mhm,
did come out with a way to help slow those deaths,
mhm,
which was amazing. I think that was clutch. Um, and they did appear to come fast. But they, used some technology that they had been studying for years, and it had been around. But it did appear fast, and so some people like us, we were like, we good on that.
mhm.
But after time, learning more, becoming more comfortable with it, we, at least me and you and a number of Black people, we decided to get vaccinated. But it's still so many of us out there who are not vaccinated. So we
Yeah,
got some work to do.
definitely.
Got some work to do.
Yeah.
Now COVID is like relentless. COVID is living its best life all the time. I think that we are going to probably see another surge coming. We already know, cases are going up. They've been going up over the last few weeks. Um, I know about 12 people that have tested positive in the last week, and
Wow.
this is the second time for like two or three of them that they've had COVID.
Right.
I
Wow.
don't know. How's everything going on your end? Do you know anybody that has COVID, that's had COVID?
Not personally right now,
Okay, good.
but I also know that, you probably won't hear about it. Like certain people, you'll just be hearing like certain people when they get tested for it. So it's like, especially if you're already boosted and vaccinated, you're pretty much not going to have no symptoms, depending on whatever is going on. So you might not know, but it's good to be vaccinated. See, that's the whole point. Like we already at the point now where we know the vaccine works. It works. It's just simple. It works. I get the early hesitancy. I get it, but it works. I'm living proof. You're living proof. We all felt some type of way in the beginning. That's why we calling our mission the reset. See, the reset is just to get everybody back inclined, how serious this is, and why we need to get vaccinated. For everybody that was on the bench, now it's time to play. So,
That's right. Let's get in the game. Coach put me
mhm,
in the game.
right.
Let's like keep ourselves safe. Let's keep our family safe. Like let's do the right thing. Now, I do know that some people that have gotten 2 doses of the mRNA and have gotten a booster, some of them are still getting sick. So this Omicron variant is like relentless. It has It got its cousins, it's got its stepkids, like everybody out here in these
Right.
streets getting people sick. So the few people who I know who have had the 2 doses, that got the booster, that got COVID, they sick. Like they sick. And that's just because the vaccines were created from the first versions of the coronavirus. And since then, the coronavirus has changed. And so that's telling us we're probably going to need to get some kind of booster this fall, maybe. I know that the drug companies are working on it. But the good thing is that the 2 doses and with or without the booster is still proven to keep people out of the hospital and keep them from dying. Overwhelmingly. There are some exceptions, but for most people, if you get 2 doses, at least 2 doses, you'll still be protected from being in a hospital and from dying. So that's huge, because that's what we needed the vaccines to do, is keep us out of the hospital, keep us from dying. And so it's still doing that, but you're still gonna feel it. Like you're gonna be off work, you're
Like a
gonna be in the
flu.
bed, you're gonna have a fever, chill, like you're gonna have those symptoms, because the virus is just getting smarter. The
Right.
more it's around, the more it can study us, it can study our bodies and learn how to get around any defenses we think we doing. So we like have to stay on it. It's hard to get ahead of it. You have to stay on it and adapt. And we're probably going to need another vaccine. Like everybody that's already been vaccinated is probably going to need another one just to protect you against Omicron. So that's probably coming up sometime this fall. But for now, to get through this hot girl summer, hot boy summer, we're going to need some protection right now, because I don't know how soon the companies will be talking about a new version of the vaccine.
Right. Okay. I mean, yeah, Doc, I get it. I mean, like I still been out in the barbershops. I had a couple of conversations with some interesting brothers, and they would still talk about it. It's still a topic, but I mean, what I got out of it is I had to tell this brother that you still got to wash your hands. That was something that we were supposed to keep doing if you wasn't doing it as frequent. So, and still use hand sanitizer. I
How
mean,
come you had to tell him that? Like, what you saw him not wash his hands? Like, what happened?
no, I mean, he just was saying like, it's over, and
Oh.
and people still getting it or whatever. I'm like, well, listen, we still got to protect ourselves.
Yeah.
I mean, number one, we're getting vaccinated. Number two, we're keeping what the stuff going on, like your hand washing, and we got to keep that whole energy going and incorporate it in our everyday life. Like we wash your hands frequently now. Even if you wasn't before, it's like we know for a fact now that things can be transferred through the touch. So you gotta wash your hands, bro. You gotta get your hand sanitizer every time you go in a different area, or you touch something different. You gotta get frequent with that, because it's not going anywhere.
Yeah,
It's
true.
like it's just that simple. It's like we wanted to just go away. Like, okay, then we got over that we got over COVID. We'll never get over it because it's introduced now on the list of things that we can catch.
Yeah, it's just
It's
one of the
it's on the disease list now. So it's official, like the flu or all these other vaccinations that people got to get yearly. It's on the list now. So
absolutely.
we got to add it. We got to add it on our list and catch up. I mean, we got 2 years in, Doc.
Yeah.
So we had enough time to get the proof. If somebody air fell off, nothing. I'm good. Everything's still intact.
All your bodily functions still working good.
Right. I'm defensive. I mean, I feel good. I mean, of course, you might still could get a cold. I mean, it's allergy season.
Yeah.
Things still gonna be normal in that aspect. But you have to add this. You got to add this to your arsenal, though. You got to add the vaccination as your defense. We don't know what's going on. First of all, we're the most traveled through country. So that's a big problem. We're the most traveled through country. I mean, connecting all the countries of the world. So it's always something coming in and out of here.
That's true.
You know what I'm saying? So it's like we got to be more protected, especially with people traveling more. It's like people traveling more on our end and people coming here. So it's like now we just keep crossing paths, and we gotta get some defense on it.
Sure, that's true. Yeah. One thing you said, you said that people have colds and allergies now. And what I wanted to mention is that the symptoms look alike. So like the sore throat, the runny nose, cough can be allergies. It can be a cold or it can be COVID. Now at work, what we say is if you have symptoms, you need to get tested. So no, everything is not COVID. That's so true. But you don't know what is COVID unless you get tested. So there's lots of opportunities to get home tests. I know that the government just released another round of tests for people, and they're doing 8 tests this time. So I sent the link to Bilal. I'm like, yo, can you get our test ordered? So make sure you take advantage of that. And Dr. Thomas, I don't know if you can find a link online, but if you can put that in the comments so that people know that they can get their tests from the government. If you have insurance, this is another great thing. You can use your insurance, go into the pharmacy, hand them a couple tests, and have them bill your insurance. I know that Walgreens does it and that CVS does it. I've gotten 4 tests for every person in my household so far. And I was talking to a coworker today, and she said that that our insurance covers up to 8 tests per month. So depending on your insurance, you can call them and ask, but they may all be the same. I'm not sure, but we can get up to 8 tests covered per month for free. So take advantage of those and make sure that you're testing if you have any symptoms, because you don't know what it is and you do not want to be out here spreading COVID, especially if you're around people that's not vaccinated. So, you know, this is not just about our own health, our own family. This is about our community, our people. And we know that the vaccination rates in Black people are really, really low. Well, they're lower when compared to other groups. And so if we're not going to get vaccinated, at least be tested and know if you're positive, if you have any symptoms, so that you're not spreading it to other people that may not be vaccinated. Because what will happen is that person could end up in the hospital, or that person could end up spreading it to someone else that's in the hospital. Like, we got to cut this spread down. So in addition to what George mentioned in terms of washing your hands, also please wear a mask when you're out in public. That we know how the disease is spread. It comes out of your mouth. It comes out of your nose when you breathe, when you sing, when you talk, when you eat. It's just like spilling out every time you open up your mouth. It's invisible. You can't see it. And if you don't have any symptoms, then you can't feel it. But if you keep yourself protected with a mask, then people that's around you can't just plop it in your system. And if you have COVID and don't realize it, you can't spread it to anyone else. So please, 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 please wear a mask to make sure that you're protecting yourself and that you're protected from other people that's walking around. I had a friend that said she got COVID from work. They didn't have on mask, and one of her colleagues showed up to work. She had like a slight cough and a sore throat, and she thought that she, had a cold or had allergies or something. She ended up getting tested for COVID the next day, and she was tested positive for COVID. And then my friend got COVID. So it's like, you at work, like, don't go to work sick. Use a sick day if you have a sick day, or like if you don't feel well, put a mask on. Like, we have got to do a little better, because we don't know the long-term effects of COVID. And that is one thing that concerns me a whole lot. Like, we don't know what's going to happen once you've had COVID once, twice, 3. There are people that had it 4 times already. What kind of damage is that virus doing to your cells? And we know some people have like long COVID, which is a big deal, but we don't know how long those symptoms last. I don't want them for a day, let alone for a couple months. So we just have to do it the best we can to cut down on the spread and to help our people get vaccinated.
Yeah, I mean, that's why we're still here. I mean, it's not like we the news coming on, but we are kind of basically the news, reporting it to our folks. I mean, we gotta catch up. I mean, we have other things going on in our community as well that we fighting. So we need to fight against everything. You know what
Absolutely.
I'm saying? So this is what another fight for us. We're trying to play it off, but it's not going nowhere.
Nah.
So we gotta get that. Go ahead, Doc. What you saying?
Oh, I was going to say, I wanted to talk a little bit about the booster. So my mom had texted me a few weeks ago and asked, should she get the second booster? And I didn't have an answer for her because I needed to read up a little about it. So I wanted to talk about that a little bit.
Okay.
So in terms of a second booster for those that the CDC recommends it for, so these are people that are high risk, they're above the age of 50. I don't know. It's hard to say. We know that there's probably going to be a vaccine, a new version of the vaccine coming around the corner this fall, most likely. The second booster, the idea behind it is to bring up your from antibodies because they start to drop over time. But if the purpose of the vaccine is to keep people from dying and keep them out of the hospital, the 2 doses plus 1 booster is doing that pretty good. I don't know if people really need to get another booster because what they were also saying is that if you get a second booster, the protection is only lasting about 4 to 6 weeks. So it's not even like you're getting months of protection. You're getting a few weeks of protection. So in my mind, I'm thinking if you're a person who is doing something that's high risk, if you're out and about, if you're around people all the time, especially with the summertime coming, and you don't like to wear a mask, but you got the first 2 doses and 1 booster, it's been 5 months, and you're like out and about, don't wear a mask when you're out, or if you have to fly and you're like around people in close quarters that may not be masked, then that may be a good idea for you to get a booster just to start your immune system to get some protection in during that time. But just know that the protection won't last like for a couple months. For most people, it seems to last about 4 to 6 weeks, and then your antibodies start to drop again. So I told my mom, because she's really cautious, she's not out and about and doing a lot of things most of the time. I said, as long as you wear a mask when you're out and you are not around crowds of people that don't have masks on, I would just wait until the fall until we get this next one, because I don't know what's going to happen. We keep giving ourselves all these boosting.
Right.
I'd rather just wait to the one that I know that protects against that, the Omicron variant, and then kind of go from there. So that's what I told my mom to do. And my grandma the same way. She's home. She's not going anywhere. She's not around people. The second booster only going to give you a few weeks of protection. I don't know if it's worth getting it if you just might as well wait. So that's what I told them.
That's good advice, though. That's good
advice. What
you
think, Dr. Mink?
Nah, I mean, I think that's good advice. I mean, like you said, we're not really here to like keep advocating for things that we don't know about. Yeah. So, I mean, if you already got the booster, it's up to you. I mean, like you say, you're not really recommending it because you're not sure. And then with different variants floating around, you don't even know which variant you got, and you don't even know if it's going to be able to fight it. So let's wait and see what's going on. I mean, we just got to get vaccinated. Let's at least get on the first 2 first.
Yeah, let's just get the first 2 doses in, and then kind of go from there.
At least, like, I mean, it'll make you feel a little better once you get it. Like, again, I know why we held up, but it was 2 years ago. So it's like, come on now. It's like we're 2 years in. We're in a relationship now. We have a relationship with COVID, okay? And it ain't going nowhere.
We're together forever,
right?
Boo.
We want it up. So it's like, listen, we got a defense up though. Seriously, though. I mean, we just, our people. I know why we stubborn, but we just got to break out some of the old habits and let's step up. And we're not really just doing no commercial. We know it works. So, I'm comfortable. I got the doc on my side. So we got all the facts. She got connects all over the place. It's called Big Doctors, CDC right now. Call them, Doc. It's like, nah. But nah, but I'm serious. No, we good. Like, doctor folks, like, and we like really care about the community. Yeah. Trust the resident. Shout out to Carol for winning. Congrats. I had to slide that in.
Congrats.
But we just breaking some barriers. Like, Doc, you one of the type of females that's stepping up in the community. Same as Carol. That mean a lot. You speaking on behalf of what you believe in.
Absolutely.
So, I mean, that's why I'm glad to be a part of the team. That's important. We're trying to really help the community.
Absolutely.
This is one of those. This is not a scam, y'all. This is not a scam.
This one not. It's
Nah,
a lot of them out there, but this one
it's
is
not a
no.
scam. We care. So let's work on our health. And I mean, even with the kids, doc. So what's the deal with the kids though? Because that's what I wanted to talk about. How you feel about the kids?
Yeah, so I know that the FDA authorized the kids booster for kids that's age 5 to 11 yesterday. They authorized that. And I was like clutching my pearls, like, oh, come on, man.
Mm,
Pfizer, so that's from Pfizer. I have mixed feelings about it. Number one, I have a child that's 2 years old that ain't been vaccinated yet. So I'm like,
yeah.
Pfizer, all y'all resources need to be going to these babies that's not vaccinated. Y'all
Yeah.
trying to get kids boosted. People ain't even got their kids vaccinated. Like,
Yeah.
what y'all worried about the booster for? So I know it's a business move. I know, and I get that. And so I'm not mad at them for that. I just don't appreciate that my child is still not vaccinated and y'all worried about some kids boosters. But
Yeah.
that's that. Now, the same thing with the kids boosters is that the protection isn't going to last very long right now. And so I mean, I'm right now, I don't have any plans on getting my daughter. She's 10. I don't have any plans on getting her boosted.
Right.
We know that the 2 doses of the vaccine is still pretty it's well, kids have a lower chance of being hospitalized and dying from COVID anyway. So the risk is lower. And if they get COVID, they're probably going to have symptoms, even if they have been vaccinated. The purpose of the booster, again, is just to boost up the antibodies, but I don't know if that's going to change the outcome of anything. I haven't seen any data like, okay, well, you have more antibodies. Does that mean that you have a less chance of being hospitalized or dead? And I haven't seen that data. So I don't have a reason to give her the booster at this point. Dr. Thomas, you have 3 ones. I know you might not want to come on camera, which is cool, but you want to come on audio and share what you feel about the booster?
Sure, yeah, I'm happy to do that. I'm leaning towards waiting to the fall, kind of for the same reason that you stated for adults, just to wait until when they're back in school, masks are no longer mandated, so
Yeah.
it's hit or miss when they're going to keep their masks on, and there's no adult reminding them to put their masks on. So I'm leaning towards fall, but also keeping in mind, as you stated before, that vaccination doesn't mean that they won't get it. It just means they won't get as sick. So, the same things apply if they do test positive for it. They're still going to be out of school and have to isolate and things like that. So I think that should also weigh into a person's decision-making process. But although I do think do the quarantine durations, are they different depending on if you're vaccinated or not? Like in terms of how long you have to stay quarantine? I can't remember.
I think it differs depending on the school. I think everybody has their own policies, like all the districts, they all have their own policies. Private schools have like different policies. So I don't think it's standard. I think that the CDC may make a recommendation, but I think that the schools implement their policies on the local level.
Right. And the main thing the school is worrying about, if you see most of their debates, is about the mask. So it's hard to force this, especially on your kids. So, I mean, I get it for the parent that's really on the bubble with their children. I mean, they still growing in certain things. And to me, it would depend on the area they're going to be in. If they're going to be in a volume, like in some of our neighborhoods where we know it's not a lot of vaccination, I would be for it. I would be for it more, depending on the population, if most of the population is vaccinated or not.
You better make a clinical decision, Dr. George Mink.
Hey, that's just me. I'm just, and I gotta get the parent perspective.
I see the critical thinking happening.
And I gotta do a parent perspective though. That was totally from a parent perspective. It's just, we definitely don't want your child to get it because kids have died from it.
Yes.
Even though it's not likely, you still don't want your child to be that 1 or that 2 or that 3. So I mean,
absolutely
it's serious. It's serious, y'all. We can't ignore it. It's just I just know for a fact. But the kids is a little shaky for me. It would depends on the environment.
A big problem is that there are so many kids in that 5 to 11 group that have not even gotten the first dose.
Yeah,
so I mean, with Pfizer, putting in a booster. I mean, I get why they would do that. They are a company. They trying to make money. I ain't mad at them for that.
Right.
But it's like we ain't got people that got the first
Yeah, that's true.
the first dose. So what y'all doing trying to get a booster approved? But you know, that's what they do.
Right. That's true.
That's what they do.
That's
so
true.
we just gonna use our good Black sense and make moves around that, plus look at the science. Like we're not gonna ignore the science, but that don't mean we're gonna just hop on everything.
No, we're not jumping on board just all the way. Okay, we just looking. All right,
with our good eyes.
We just peeking in. That's all we doing right now. So we just giving y'all heads up. It's up to you, but if you're not vaccinated, you can't even discuss your child. So let's work on getting the parents vaccinated first.
Yeah.
Get our numbers up, and then we can concentrate on the kids.
Yep. Absolutely. I wanted to go back and clarify something. I know that Dr. Thomas had mentioned the timing of the test. So that's really important. So I know someone that had some COVID symptoms. They had a sore throat and they weren't feeling good. They took a COVID test the next day and their test was negative. They still was down. They stayed home from work, took a COVID test on day 4 of the sickness, and then that test came back positive. So the timing of the COVID test is important too. So although you may have you may experience some symptoms and take a test, it's negative on that day at that time, you may not have enough virus in your body to come up positive on the test yet. So you may have to test a couple days later, especially if you're still feeling sick. And so that's why I think it's great that they're giving out 8 tests through the mail with the government, or your insurance could cover up to 8 or more per month, because we're going to need that many, because people may need to test a few times before they see that it turns positive.
Right. Wow. The test thing is big too. That's like having an aspirin now.
I know, just keep the test around. You know,
we gotta keep the test around. We just gotta incorporate it in our lifestyle. So It's like that test thing is big, because at first I didn't think they was going to be accurate, and they work.
Yeah, they do work, but you got to use it right. It's complicated. Like the steps are really kind of complicated. I think I'm gonna do a video to kind of make it easy, but they're all not the same. So I got to figure that out. But it's a process.
Maybe you could practice on me, Doc. I'll be the patient.
Yeah. Can you read steps 1 to 13 and take this video? I mean, it's a lot, but so we can do like a fun video. I think that'd be nice.
Right.
All right. Well, let's wrap this thing up for the day. I wanted to always say before we leave is that if you have questions, I know people say call your doctor. Everybody don't have a doctor, but y'all got me. So if anybody have questions about the vaccines, anything, y'all can always call or text 267-322-0470 and let me know. And I'm always glad to help. So that's all we got today. We got some vaccine clinics coming up. We'll announce the dates and the times and locations next week. So stay tuned for those. But we out here in these streets, we busy. We trying to save some lives.
Yeah, that's what we doing. All right, Super Doc.
Super Doc on the scene.
All right, everybody. So I guess that's it.
Let's
go. We next.
Thanks for tuning in. Have a good day, everybody.
All right, everybody.